Everyone, thanks for listening to my presentations. Today I'm talking about lactulose. Lactulose, have you used it before, or someone around you, or by any means, whether you're a medical practitioner, you prescribe lactulose? Let's go. Lactulose could come under different trade names. Could be constipation, Enalose, Generalac, or Crystallose, depending on which brand is available where you're working or where you're living. Belongs to a class of medications known as osmotic laxative and also as ammonium detoxicant. That's why it's useful in constipation and hepatic-encephalopathy. The forms could be in the form of oral solution at 10 grams per 50 ml. Crystals for oral solution could be dissolved in 120 ml water. Rectal form could be in 700 ml water or normal saline. Notice, there will be poor gastrointestinal tract absorption of lactulose. Bacteria will degrade the lactulose, producing acidic pH. The low pH will lead to inhibition of diffusion of ammonia into the bloodstream by enhancing the conversion of ammonia to ammonia. In other words, ammonia will not go into the circulatory system, it will be ammonium because there will be conversion of ammonia to ammonium with the presence of the acidic pH. It promotes the diffusion of ammonia from the blood into the gut to form ammonia. It also promotes osmotic effect in the colon, leading to increased peristalsis and abdominal distension. Reduction in ammonia concentration will eventually lead to a reduction in the degree of photosystemic encephalopathy. Uses: very useful to treat constipation, very useful to prevent photosystemic encephalopathy. So for prevention of photosystemic encephalopathy, lactulose. Also for treatment of photosystemic encephalopathy, lactulose. Even in the phase of overt hepatic encephalopathy, lactulose. And also in palliative care, when we are faced with constipation, lactulose. For purpose of fecal impaction with slow disimpaction, lactulose. Adverse reactions: might be faced with hypokalemia, hypernatremia, dehydration, abdominal cramps, abdominal distension, abdominal distress, and of course diarrhea. It's possible we'll be faced with eructation or burping. Some people call it belching, depending on which terms is applicable where you are. You can have flatulence, nausea, and vomiting. Contraindication: lactulose is contraindicated in anyone requiring a low galactose diet. So, don't use lactulose in galactose-restricted diet individuals or anyone who will need galactose restriction. No lactulose. Warnings: remember, while prescribing lactulose, there is likelihood of severe electrolyte imbalance, particularly in elderly And in anyone that will be taking lactulose on long-term basis, in moribund patients or individuals with hepatic disease, and particularly in infancy. Remember, more than 60% of the body weight of children is fluid. So, when there's massive dehydration, we are sending the children to the grave. Still part of the warning is that in people with diabetes mellitus, use lactulose cautiously. And why that? Lactulose will contain galactose and lactose. And you know what that means. Again, I'll repeat, in infants, severe dehydration is very likely with severe hyponatremia. So be cautious. Even if possible, don't give it to infants. Drug-drug interaction. Please kindly contact your pharmacist or your clinical pharmacologist, because it depends on the particular medication or drug you want to prescribe at that moment. So I cannot exhaust the list of drug-drug interactions here. In pediatric age group, you can administer lactulose at dose of 1 to 2 grams per kilogram per day or 1.5 to 3 mg per kilogram per day. In infants, but remember, I've just said in the last few minutes that if you have your way out, don't prescribe it in infants. Okay, but if you must, then infants could take 1.7 to 6.7 grams per day or 2.5 to 10 mg per day in divided doses. Children and adolescents could take a little bit higher at 26.7 to 60 grams per day or 40 to 90 ml per day in divided doses. In all, adjust doses to get what? 2 to 3 stools per day. That is the goal. Once you have achieved 2 to 3 stools per day, then the dosage should never be increased any longer. Okay, examples of where and when we can use lactulose. Constipation. Can give lactulose per oral at 10 grams per 15 ml to 20 grams in 30 ml, or 1 to 2 packets once daily. In hepatic-encephalopathy, you can give per oral 20 to 30 grams TID or QID if the patient is still conscious, and the goal is 2 to 3 stools per day. Anything beyond that, you are treating the patient to another problem entirely. If this is a case of hepatic-encephalopathy and the patient is unconscious, you can give per rectum in form of retention enema. 200 gram true rectal balloon catheter will be welcome here. You may choose to give lactulose per nasogastric tube only in conscious patients. And with that, I've come to the end of this short presentation. Lactulose is a very good drug to help in constipation and, more importantly, in ammonia detoxification, because ammonia will worsen photosystemic or hepatic encephalopathy. To those in gastrointestinal unit, they know the importance of lactulose, particularly when they are dealing with constipation and liver failure. In the phase of hepatic encephalopathy, the role of lactulose cannot be overemphasized. It's a good drug when used appropriately. Thanks for listening. Remember to share. Remember to subscribe. I appreciate it.